Imagine you are out and about with your children, perhaps at a park or running errands, and suddenly you realize their hands are looking a little grimy after touching playground equipment or shopping carts. There is no sink or soap in sight. What is the best way to get their hands clean in that moment? While soap and water are always the gold standard for cleaning hands effectively, hand sanitizer can be a valuable and effective alternative for kids in specific situations where traditional washing is not an option. It is a helpful tool in your child health toolkit when used correctly. The primary reason soap and water are preferred is their ability to physically remove dirt, grime, and most types of germs from the hands. The friction from rubbing hands together under running water, combined with soap, helps lift and wash away microbes and even some chemicals. Hand sanitizers, on the other hand, primarily work by killing germs on the skin using alcohol. They do not physically remove dirt or debris. This means if hands are visibly dirty or greasy, sanitizer will not be as effective as a good scrub with soap and water. Therefore, think of hand sanitizer as your go-to when hands are not visibly soiled, but you suspect germs are present, or when soap and water are simply unavailable. This could be after touching public surfaces, before eating a snack on the go, or after coughing or sneezing into hands when you are away from home. Always choose a hand sanitizer that contains at least 60% alcohol to be effective against most common germs. When using hand sanitizer with children, ensure you apply enough to cover all surfaces of their hands. Teach them to rub their hands together until they are completely dry. Supervise younger children to make sure they use the sanitizer properly and do not ingest it. For very small children, consider carrying sanitizing wipes as a safer option to control application. It is also important to know that while alcohol-based hand sanitizers are powerful germ killers, they are not effective against all types of germs. For instance, they do not work well against non-enveloped viruses like norovirus, which causes stomach flu, or certain bacteria such as Clostridioides difficile or C. diff, which can cause severe diarrhea. Furthermore, hand sanitizers do not remove harmful chemicals, such as pesticides or heavy metals, from hands. For these specific situations, you must always prioritize washing hands with soap and water. So remember, keep those hands clean for a healthy child. Use soap and water whenever possible for a thorough cleaning, especially after using the restroom or before preparing food. Reserve alcohol-based hand sanitizer as a smart and convenient backup when water and soap are out of reach, ensuring your children stay protected from germs even on the busiest days.